Hi, my name is Barbara Murphy. I'm a medical oncologist. My area of clinical and research work is head and neck cancer. There are approximately 50,000 cases of head and neck cancer diagnosed annually within the United States. Unfortunately, most of the patients that we see present with locally advanced disease. That means they require multimodality therapy in order to attempt to cure their cancers. Head and neck cancer affects critical structures such as the tongue, the larynx, which is your airway, the upper esophagus and the pharynx, which allows you to swallow. It affects your face and your facial structures. It therefore affects all of the parts that make us human and allow us to communicate with other individuals and allow us to express and be ourselves. Unfortunately, treatment is also associated with a lot of side effects, and those side effects occur acutely during therapy, and they also persist for many patients long term. When patients have completed their therapy, they often are very different individuals than they were before they started their therapy. After treatment, patients have to renegotiate their identity, their social identity, their spiritual identity, and their emotional identity. This takes a great toll on them and also on the people they love. So there are a lot of stresses and strains on patients and their caregivers, and they have many needs. There are numerous unmet needs among the head and neck cancer patient population. First, some patients are uninsured, and because of that, they're unable to access care in a timely manner. If you can't get care, oftentimes you delay going to the doctor, and that means that when you do present to the doctor, your tumor is advanced and less likely to be cured, or even uncurable. Even with the best insurance, head and neck cancer costs patients a significant quantity of money and time. It also costs time and effort on the part of their caregivers. Some patients don't have the financial wherewithal to make sure that they do all of the things that are required to get through treatment to maximize their outcomes and maximize their chance for cure. Some of the problems include inability to get to their doctor's appointment because they don't have gas, inability to obtain prescriptions that will help them control their symptoms, inability to pay for nutritional supplements that can keep them from losing weight. They also need supplies for trach care, for feeding tube care, for wound care, for mouth care, and dental care. Unfortunately, many of these supplies are not paid for by insurance, and so the patients have to pay for them themselves. This puts a tremendous financial burden on patients, particularly if they are unable to work, and it puts a tremendous financial burden on the family and the caregivers. One of the important things to understand about head and neck cancer is that many cases are preventable. First, by preventing smoking. We need to keep our young people from starting smoking, and for those who smoke, we need to help them quit. We also need to make sure that people don't take up the habit of chewing tobacco. Another very important area of prevention is vaccination. Human papillomavirus, which is a cause of cervical cancer, is also a cause of oropharyngeal cancers. This is a type of head and neck cancer. The vaccine that is available for cervical cancer may also prevent cancers of the head and neck in the oral pharynx. It is therefore very important that we make sure our young teenagers are vaccinated, both boys and girls, so that we can prevent the development of cancers from this virus. Patients who go through head and neck cancer therapy oftentimes need radiation as a part of their treatment. Radiation therapy involves directing radiation beams specifically at a tumor in order to make sure that the tumor is targeted and not normal structures, normal tissues. A mask is fitted over the patient's head in order to immobilize them. That mask is fit very tightly over the face, the jaw, the eyes, and the head, and then the patient is bolted to the table so they can't move. This can cause just absolute tremendous stress for patients. You can imagine if you are bolted to a table, you have sores in your mouth, you have secretions that are blocking your airway, you have pain, and you're alone. And you have to stay that way for 10 or 15 minutes every day, Monday through Friday, for 7 weeks. Imagine what you would feel like. Many of our patients develop very severe anxiety related to their radiation, and sometimes that persists and they develop post-traumatic stress disorder. The mask becomes a symbol for patients. It's a symbol of what they've gone through in order to get a cure. It's a symbol of their loss of control. It's a symbol of their need to renegotiate their social identity. The mask becomes incredibly powerful. In Courage Unmasked, the mask that means so much to patients with regards to their cancer is transformed through art. And it no longer is a representation of the negative aspects of their cancer, but it can be transformed into something positive, something meaningful, something that can bring hope to future cancer patients and understanding to the people in the community who have never ever seen or heard of head and neck cancer. Some of the services that are required include speech and language pathology, to help them regain their ability to swallow food normally, speech therapists who can help teach them how to communicate once again, physical therapists who can help them regain jaw, neck, shoulder range of motion and improve posture deficits from their treatment, psychologists to help them deal with the anxiety, depression, and post-traumatic stress disorders that can result from treatment, nutritionists who can make sure that they get in enough calories and hydration in order to rebuild, and counselors and groups that help them rebuild who they are and rebuild their lives after their treatment is completed. I'd like to thank you for joining us here on this website. On behalf of the head and neck cancer patients, their caregivers, and all of the staff, we really appreciate the time that you've taken to listen to these stories. We'd also like to ask you if you could give to this very worthy cause. Head and neck cancer is a disease that has not been highlighted in the press and does not have great public awareness. We need to change that. In order to do that, we need your help. We would love a gift of your support, not only monetarily, but also if you could reach out to your friends and your families and get them involved as well. Thank you again.
Hi, I'm Dr. Arnold Malcolm. I'm Chairman of Radiation Oncology here at Vanderbilt University Medical Center. I've been a radiation oncologist for about 40 years plus, and I've seen all the new innovations in the techniques of radiation therapy over 40 years. It is tremendous. It keeps changing every single day. We here at Vanderbilt stay abreast of all those techniques. We have an outstanding multidisciplinary team of radiation oncologists, medical oncologists, surgical head and neck oncologists. It takes a village to do a great job in this disease. This is not a disease in which one person can take care of a patient. I think all three modalities are imperative in making sure patients get the right treatment in all the aspects that are needed to treat this disease. So let's talk about radiation therapy in regards to head and neck cancer. I think most people don't recognize the fact that the new treatment we talked about, IMRT, intensified modulated radiation therapy, was focused on head and neck cancer. That's how it all started. And the reason for that is because the techniques that we utilize to treat head and neck cancer are using external beam radiation to treat the tumor in the site that it may lie in, including the floor of mouth, base of tongue, larynx, etc. However, there are major structures around those areas, mostly the spinal cord. So IMRT, which we do here at Vanderbilt and many other centers, was specifically designed and around head and neck cancer, and then it has been moved on to other diseases like prostate cancer, but really head and neck cancer has actually been the leading disease that has helped move radiation therapy forward in the future. Another aspect I should talk about us here specifically at Vanderbilt is that unfortunately, like all cancers, they can return. This does occur in patients with head and neck cancer. We have taken upon ourselves to be aggressive, when possible, in retreating patients, recognizing that we ourselves, as physicians, are taking risks to help our patients. We're probably one of the major centers in this country who are willing to treat patients in very significant and difficult circumstances. But we use all the modern techniques. We have several physicists to help us work on all these things. We use many, as we talked about, IMRT techniques to protect normal tissue or tissues that have already been irradiated because we are re-irradiating those patients. They're just tough, difficult cases to take care of. The other thing I should say about radiation therapy for head and neck cancer, it, from my opinion, is one of the toughest areas to treat because all of the normal structures that are going to be disrupted with the course of radiation, it is one of the toughest areas as a radiation oncologist to convince, work, control a patient to tolerate this aggressive therapy because it can be life-changing, disruptive, at least from an acute point of view, and perhaps even chronically because of the tissues that we have to treat.
My name is Karen Munyon. I am the Director of Radiation Oncology Satellites here at Vanderbilt University Medical Center. My role is to direct 3 of our off-site radiation oncology facilities as well as to support the main campus location. I got involved in radiation oncology during my college years. I became interested and knew I wanted to do something in the medical field but did not really know what I wanted to do and lucked into this field. The minute I saw it, I knew it was something I wanted to be a part of. It had the technicality of computers, but also the human element of taking care of patients. Each patient's treatment is unique and focused to them. So even though you may be treating 5 or 6 patients in a row that are the same diagnosis, each and every patient's treatment was different, and I really liked the unique individuality of that. During my role I have to start over.
You're fine. No, you're fine.
During the early years of my career, I was a radiation therapist, so I spent many hours treating patients. It really is the absolute love of my career. I miss that on a daily basis since I'm now more in an administrative role, although it does allow me to ensure that our patients are being treated properly and correctly, as well as very safely. And it also gives me, I think, a rapport with our staff because I do have the knowledge and skill that it takes to treat patients, so I understand the problems and some of the issues that are encountered treating patients on a daily basis. I think some of the most unique things that I remember about treating head and neck patients have to do with the type of patient that you have. Typically, those diagnoses that are in the head and neck region are a little bit more advanced just because of sheer nature of location. You have a lot of small parts and close anatomy in that area, and so when you have cancers in that region, it can affect them greatly. Everything from changes in taste, inability to swallow, inability to keep weight on, all can affect the radiation that we give our patients. And so it's very important that we closely monitor our patients and also ensure that they maintain healthy weight and be able to get through their treatment as painlessly as possible, although it's probably one of the roughest treatments that our patients go through because of the fact that it does affect the swallowing, the mouth, saliva, all of those things that we depend on as regular human beings on a day-to-day basis. Being a radiation therapist gave me a unique aspect to treat head and neck cancer patients, and they're all different. Most of our patients have very complex issues, ranging anywhere from keeping on weight, swallowing, breathing issues. We have skin irritation in the neck. It's very hard for them to maintain a stable diet. It's very important for our patients that they not lose any weight during this process. It's not the good time to go on a diet. They need to maintain a healthy weight. It's important for the body function because it allows them to fight the cancer cells as well as the normal cells that we're killing with radiation. The body has to get rid of those in some form. And if it's not healthy every place else other than the region that we're treating, that makes it very difficult for our patients. Many patients have problems with swallowing. They feel like there's a lump in their throat. They have to stay away from foods that they often love. Acidic, spicy foods cannot be tolerated because of the amount of radiation that they're getting. Things such as keeping normal dental care becomes extremely important because we don't have saliva like we did before with the radiation. It actually damages some of the glands, and we try to spare those glands as much as we can, although there is no 100% way to do that. So often that effect changes the way that we digest our food. It also can cause more dental caries and cavities and things of that nature, so dental care becomes a very important part as well. Patients often will go through a period in the beginning of radiation where it may not seem like it's having much of an effect, but it is cumulative. So what happens is they get to a certain portion of their treatment and then it feels like all of a sudden everything hits at once. So we have to encourage our patients to maintain that healthy weight, to stay on their plateau, to beef up their diet in other ways, maybe adding Ensure to a milkshake instead of milk to get extra calories, eating several small meals a day instead of 2 or 3 big meals, making sure they get enough rest. Rest is extremely important, and fatigue is a huge side effect. So listening to the body, taking that nap in the afternoon where you normally would not have, greatly benefits the patients as well. Oftentimes, patients will encounter a phase where they may feel depressed because they're not able to do the things that they normally do. Either whether that be enjoying a meal with their family, going out and being able to be outside because they do have to protect the skin in that area because it does have a radiation sensitivity to it and acts as if a sunburn has happened in that area. Also, making sure that they get enough rest. They just don't feel like that person that they were when they started. The side effects that come on with radiation oftentimes don't peak until after the radiation has completed, and usually it's a couple weeks after the last treatment. So what happens is those patients are climbing up a plateau, and they don't plateau until after the patient's radiation has completed. Then they finally get on that downhill slope and begin to heal from all of the effects and the things that we've done to them to help them get through this process of treating cancer. Unfortunately, that can be depressing for a patient because they just feel like once the radiation is done, then they should be able to pick up and leave off where they started, but that doesn't always happen. So we encourage our patients to be patient, to get proper rest, nutrition, make sure they're hydrated, and make sure that they listen to their bodies. The one thing that I've noticed during my treatments with cancer patients is that those patients that have a more positive attitude coming into treatment generally seem to do better. No real statistical information on that, but it's just something I've noticed over my 20-year career. I know that those patients that seem to have a negative look on their cancer just seem to not flourish during the treatment as much as others. I know that what I have seen, sometimes it's difficult for patients to let go of daily life because they have spent their lives taking care of someone else. This is their time to focus on themselves. We often tell our patients, don't worry about something. It's hard not to worry, but your focus needs to be on you. It's your time to focus on getting your cancer care and getting through your treatments, all of those things, and focusing on you so you can help others again. We want our patients to be cured and to come back and say hi and tell us how they're doing. We want to know they've done well and that we've done a good job as well too. So the best advice I have for patients is listen to your body and rest. Make sure that you're getting everything that you need, and don't worry about everything else. The house will still be dirty when you come back at the end of your treatment. It will still be there, I promise. There's no rush to do those things. Just focus on you.
Hi, I'm Jen Craig. I'm a speech pathologist at the Vanderbilt Voice Center, and I work a lot with patients with head and neck cancer. Patients with head and neck cancer oftentimes have something called dysphagia. Dysphagia is a fancy way of saying swallowing trouble. Swallowing trouble can be anything from food and liquid getting stuck on the way down, food and liquid going down the wrong pipe, or food and liquid coming out the wrong pipe. Dysphagia can be very, very dangerous. If food and liquid go down the wrong pipe towards the lungs, oftentimes it's uncomfortable and it can make a patient cough very heavily and very frequently. If it does go down the wrong pipe, it can also give a patient pneumonia. Especially in our head and neck cancer population, when immune systems are already kind of depressed and patients are weak, pneumonia can be very, very dangerous. So speech pathologists are called in to help manage dysphagia. Speech pathologists have a few different ways of diagnosing dysphagia or difficulty swallowing. One of those ways is called a modified barium swallow study or a video fluoroscopic swallow study, and that's the video you'll see running here. What we do is we give patients different textures of foods, different consistencies, and that is either a thin liquid like water, a nectar thick liquid, which is just a little bit thicker, a honey thick liquid, which is about the consistency of honey, purees, and solid foods, or combinations thereof. We mix those with barium, which is a radio-opaque material that lets us watch that food and liquid go down under an X-ray. Then we can see both functionally and mechanically what's going on during the swallow itself. Oftentimes we can make recommendations about any diet modifications that need to happen or any compensatory strategies that the patient might benefit from. Head and neck cancer patients oftentimes also have something called dysphonia. Dysphonia is a fancy way of saying hoarseness or roughness, raspiness, or an altered quality of the voice that's different from what the patient usually hears out of themselves. Speech pathologists can help patients undergo voice therapy. In some conditions, patients also undergo radiation for cancer of the vocal cords. Speech pathologists have tools to help diagnose dysphonia, including endoscopy. In endoscopy, we can actually look at the vocal cords and get an image similar to what you see here. In this picture, I can actually see all around the voice box, the vocal cords themselves, the base of the tongue, and other structures and mobility, and determine whether or not there are any impairments in that sense. Oftentimes, patients with head and neck cancer can have mobility impairments, and the vocal cords don't vibrate quite like we would expect them to. The vocal cords themselves open and close when we talk, when we breathe, and when we swallow. When we're breathing, the vocal cords sit in the shape of a V right on top of the airway. When they're working properly, they're wide open. When we go to speak, the vocal cords swing together, close, and vibrating air to allow that vibration to come out as our voice. In patients with head and neck cancer, especially those that have undergone radiation treatment, the vocal folds may not swing open and closed as readily. That can oftentimes cause breathing difficulty. If the vocal cords are swinging together or they are stuck in a median position, that will oftentimes block the airway, not allowing air to pass readily down towards the lungs. Some types of head and neck cancer impact the voice box directly. They impact swallowing, voice production, and breathing. In some patients with head and neck cancer, the voice box is no longer functional, and they also have trouble safely swallowing, breathing, and oftentimes they have difficulty with their voice as well. If this is the case, sometimes these patients must undergo what's called a laryngectomy, and that's a removal of the entire voice box itself. Typically, the food pipe and the windpipe share a common pathway towards the mouth. So when we eat and we drink, our windpipe closes off and it allows food and liquid to bypass our lungs and go down towards our stomach. When we're breathing, our food pipe stays closed and it allows air to go through our nose and our mouth and go down towards our lungs. In patients that have undergone a laryngectomy, the food pipe and the windpipe are no longer connected. The windpipe is turned outwards to form something called a stoma. The food pipe is then reconstructed so that somebody can eat and drink without the risk of something going down towards their lungs. Just because a person has had a laryngectomy doesn't mean that they can no longer communicate. There are several different options for communication in a laryngectomy patient. One of those options is called an electrolarynx. It's the buzzy thing that looks like this. A patient places it against their neck, presses the button to activate the device, and then speaks. For example,
1, 2, 3, 4, 5.
Another communication option for a laryngectomy patient is called a TEP, or a tracheoesophageal prosthesis. A surgeon will put a puncture in the common wall between the esophagus and the trachea. A speaking valve is placed, and the laryngectomy patient will reach up, cover their stoma, shunting air back through the speaking valve, vibrating the tissue in the esophagus, allowing the patient to get speech. One of the hardest, but one of my favorite parts of my job as a speech pathologist is the counseling aspect for head and neck cancer patients, and specifically our laryngectomy patients. We sit down and we talk about what can you expect from surgery, both the anatomical changes, the physiologic changes, but also what do you do after surgery? How do you get back to your new normal? How do you begin to approach working again? What are social interactions like? But the bigger part is oftentimes we get to introduce some of our patients who have already been through the surgery and have been through all the hard parts and the hard steps and are making their new way of life, and they're doing great. It's fun to watch those patients talk to patients that are about to have the surgery. What's amazing to me is the community that's formed between our head and neck cancer patients and how much they lift each other up and encourage each other. It's very humbling, and it's absolutely one of my favorite parts of my job.
Hi, I'm Sheila Reidner. I'm the Martha Rivers Ingram Professor of Nursing at Vanderbilt University School of Nursing in Nashville, Tennessee. I conduct research in patients who have head and neck cancer. I've been particularly interested in helping this cancer population since I first entered nursing more than 30 years ago and took care of many patients with head and neck cancer in the hospital who had had very severe neck dissection surgeries, and noticed that those patients were the ones that my fellow nurses least liked to take care of when they were on our unit. I've been fortunate enough to build a research career at Vanderbilt with an excellent team of researchers who are also interested in helping patients who have head and neck cancer. Research involving patients with head and neck cancer is not common, and it is underfunded. We have been fortunate enough on our research team to obtain some federal funding to conduct some very important studies that are going to provide a wealth of information about what having head and neck cancer does to a person's body. Once we obtain this information, we will be seeking more funds to try to develop interventional therapies to help address the problems that we have identified. Through our research, we have determined that almost every person who undergoes treatment for head and neck cancer develops some type of severe swelling, either in visible structures such as their face and their neck, or inside their throat and mouth where you can't easily see the swelling. This swelling makes it very hard to breathe, to swallow, to eat, and to talk. It is interventions for these types of problems that are sorely needed to improve the quality of life of people who have head and neck cancer.
My name is Jaden. I'm assistant professor at Vanderbilt School of Nursing. Currently, I'm working on several projects related to head and neck lymphedema. You may not know head and neck lymphedema, but many of you already heard breast cancer related arm lymphedema. You may see some patients have a very big arm with a huge arm, but this similar situation can occur in head and neck cancer population. In my recent study, I found that 75% participants, in other words, 3/4 of them, develop head and neck lymphedema after their cancer treatment. Why this happened? Because surgery or radiation therapy damage the lymphatic system, including lymph vessels and lymph nodes. So that put patients at a high risk for developing head and neck lymphedema. In head and neck cancer patients, unlike breast cancer patients, you can see the arm lymphedema. In head and neck cancer patients, you not only see patients have external swelling, they also have internal swelling. For example, we see patients have throat, they are severe swelling. That's really bother patients. I remember many years ago, one patient came to me and asked me his swelling. He said, "This swelling really bothers me and make me look awful. Let me tell you the truth. I want to let you know, not only I have neck swelling, I also have internal swelling. Why I find that? Because I can tell when I swallow, is something chokes, make me choke, something there, something stuck there." So that patients, I work with this patient, that's really inspired me. And then I promised to patient, I said, I will search literature and find the answer for you. But it's really disappointing for me because I couldn't find exactly very helpful information for him. Many years ago, that's back to 2008, it's very extremely limited literature were available then. So that experience inspired me to work on this area, to conduct more research, help patients address this problem. For patients, I think very important, once you notice you have some swelling, especially when you see the mirror in the morning, you see you have puffing, neck or cement with the end of the chin or face or around your eyes, you need to see your primary doctors to check whether or not you develop lymphedema. And some patients may have, feel fullness in their throat. You need to see your, doctors and therapists to see what happened. Once you have diagnosis, have lymphedema, you need to start the current standard lymphedema therapy. That include, current standard, similar like treatment for arm lymphedema, we call CDT, is completed decongestive therapy. And once you complete intensive, lymphedema therapy, that will last, based on patient's severity of lymphedema, maybe normally 8 weeks, maybe 12 weeks. After you've done intensive lymphedema therapy, you need to be taught how to conduct home self-care of your lymphedema. That will be long-term self-care of lymphedema. That include, for example, gentle neck, shoulder exercises, and manual lymphatic drainage. Your lymphedema therapist will teach you how to do this. And also skin care. For example, you need to put on lotion and in the summer. And also you need to use a compression bandage or garments. Those will be prescribed by your lymphedema therapist. Those are very important, basic, fundamental lymphedema self-care skills. As a patient, you need to conduct long-term self-care to decrease symptom burden and improve your functional status, as well as this will help you to decrease the progression of lymphedema. And based on current understanding of lymphedema, especially in head and neck cancer patients, we found that if patients didn't get enough treatment or didn't conduct well self-care of their lymphedema, they may develop a late stage of lymphedema. We call the skin become fibrotic change. What does that mean? You feel tightness your neck region. You also feel very uncomfortable pressure on your neck region. That's started, you feel when you drive the car, some patients mention the impact their driving ability is move your neck and the shoulder. Also, some patients talk about this also impact their jaw range of motion, we call the trismus. So those is a late effect related to the head and neck lymphedema. It started fibrotic change. That message indicates that patients need to conduct long-term self-care. Also, they need to see lymphedema therapists regularly to evaluate their progression or regression of lymphedema in their head and neck region. In the past few years, I have received funding from Oncology Nursing Society Foundation. I really appreciate their support for my research project, and I'm able to do several research projects. For example, conduct study to describe this phenomena. I also published several articles from this project. Also, I conducted 2 studies to address measurement issue, how to make early identification of head and neck lymphedema. Currently, I obtain funding from Vanderbilt Office of Clinical and Translational Scientist Development Program. I really appreciate this project, and currently I'm recruiting participants to understand how they conducted their home self-care of lymphedema, and I will develop an intervention to help them facilitate and also provide education information for patients how to better conduct home self-care. And clearly, I would like to say it's very important to obtain the continuous support in this area to address very, very important measurement issue, interventions, as well as any preventative intervention to help patients and to address this under-reported, under-addressed clinical problem and improve patients' overall quality of life.
Hi, my name is Dr. Bethany Roden, and I am an assistant professor at Vanderbilt University School of Nursing. Right now, my research interests include body image and sexuality in patients who've had head and neck cancer. So my first study that I was in charge of was looking at body image and depressive symptoms, ability to function, drive a car, eat, swallow, those kinds of issues, and social anxiety in patients who have been treated for head and neck cancer. So that really opened my eyes to, yes, there is a problem here. Not only have I heard patients say this to me in passing, but I can look at actual data and show that this is a real problem that patients experience during their treatment. One thing that I learned from that study was that all aspects of a person's life are affected by head and neck cancer. As society, we socialize by going out to eat, having drinks, talking with our friends and family and others. And when you're recovering from head and neck cancer treatment or going through the treatment, those are things that many people simply cannot do. The study that I'm working on now is examining sexuality and changes in sexual satisfaction and sexual function in patients who have had head and neck cancer. I was fortunate as a PhD student to be funded by the American Cancer Society's doctoral scholarship in cancer nursing for my work with body image. However, funding for this disease, particularly in the areas of survivorship, quality of life, ensuring that we not only treat the disease, but that we also help patients have a normal life afterwards. Treatment for head and neck cancer is extremely harsh and impactful on patients' quality of life and their ability to feel normal after treatment. Funding for survivorship research and quality of life research is essential to helping patients feel as normal as possible after they are treated for this disease.
My name is Cindy Tinker, and I am the social worker here in the cancer clinic. And I work with adult cancer patients and their families from time of diagnosis, in the midst of treatment, being post-treatment, cancer-free or no evidence of disease to end of life. So here in the cancer clinic, we have a lot of people that come from near and far and from all walks of life. And some folks who have enough insurance and finances to get them through their treatment. But there are a lot of folks that come through our clinic that don't have insurance. Insurance is terminated, come from very rural areas, and don't have two nickels to rub together. So when I came to work in this position, it was realized that a lot of times those needs are not, the resources are not out there when patients are needing to keep the electricity on, keeping a roof over their head, keeping a car in the driveway, or trying to keep that car up and running just to get them back and forth for treatment. So with head and neck cancer patients, it was even more evident with a lot of these folks who are very rural people, come from rural areas and struggling financially just to get here for their treatments, whatever that may be, for chemo, radiation, whatever that may look like. So knowing that there was a lack of resources in the community, we began this fund called the Caring Hearts Fund here in the cancer clinic. And it's a totally donation-driven fund, and with that, do an assessment in terms of what the patient's diagnosis is, who their doctor is, what their financial situation is, what their living expenses are, and just figuring out where it is that we can best financially meet that need. If it's making a mortgage rent payment, a car payment. We've even had some folks that we've had to help with just having their car towed to get to the shop when it's broken down, when it's gotten here to the clinic. Or helping somebody just financially with a gas card to come for treatment. Helping with a overnight lodging stay. Providing them a Kroger gift card to help with groceries, paying the electric bill. Those needs are every day for all of us, and for a lot of our patients and their families, it's even more critical, more serious, because they don't know how they're going to get their medications or where the next meal is going to come from, and just trying to figure out those needs, making use of resources in the community. And when those resources are depleted, then through the Caring Hearts Fund, we're usually able to help meet those needs in some form or fashion. With the Courage Unmasked Tennessee that we're doing here at Vanderbilt through the Cancer Center this fall, with the funds that will be raised from that event, those funds will go specifically into the Caring Hearts Fund earmarked for head and neck cancer patients. And in that account will be funds available to help specifically head and neck cancer patients, be it for gasoline to come for treatment, be it for lodging, be it for somebody that needs trach supplies, medications, nutritional supplies, whatever that may be. Doing those assessments, finding out specifically what those folks need, if it's also even just keeping the lights on at home or paying their rent, their mortgage, helping out with medications. Those funds specifically will go for head and neck cancer patients.
Hi, my name is Ann, and I'm going to talk to you a little bit about my 4-year journey. I was diagnosed with a malignant tumor in my sinus cavity on the left side. That diagnosis was almost 4 years ago. I had surgery to remove that in January of 2011. I'm going to talk to you a little bit about how this has all affected my life. There's been several occasions that things that were very important to me, I didn't feel comfortable in going. My granddaughter graduated high school. I didn't attend her graduation, and I had attended her brother's the year before. Then, my grandson, he graduated from the University of Tennessee this year in May, and I would have loved to have been there, but because of things that, I look like I'm chewing a cud. It's because of all of the saliva and mucus, and so maybe other people wouldn't really care, but I do, and it is kind of embarrassing to me. So I shy away from certain social settings. I think the biggest lesson that I have learned during this whole process is the fact that I really didn't know anything about this and what I was going through. I had been through cancer with my sister. She had bladder cancer, and she passed away on Valentine's morning of 97. And then my brother, I only have one sister and one brother, and my brother had lung cancer. He had a lung removed. He went through a lot of treatment, and then he had showed some spot in his good lung, which was the only one he had left, and he passed away in December of 2009. So going through cancer with both my sister and my brother, I thought that I knew what to expect, but I found out real quick that I didn't know what to expect, and that each step that I took, I had to question, and I had to look far-reaching. I was caregiver to my mother. We lived in the home together, and when I knew I was having surgery, a real good friend, she volunteered and told me that she would come and stay with my mother. And I said, well, I believe I'll need you about a week. And a month later, she was still in my home. I never dreamed that it would be so involved as it has turned out to be. And I'm still on a PEG tube, which we might call feeding tube. And I never dreamed that 4 years down the road, I would still be on a feeding tube. So there's a whole lot that that I didn't know that I'm sorry I've had to learn, but I know now that I probably still don't know all the lessons that I will learn. You know, through it all, there's been a lot of things that has been difficult, a lot of things that I didn't know, but through it all, I have received so many blessings. I knew that my sons were a gift to me from God. I've known that for a long time, but they proved it through this entire process. After that first doctor appointment, then they have never allowed me to have another doctor appointment without one or the other, or a lot of times both. Now, that is a blessing because there have been times that they have remembered things that was discussed that perhaps I let kind of fly over, and I didn't remember. But in a recap with them, then they would relay to me. Also, there were times that a doctor would ask me if so-and-so, is this happening? And maybe I couldn't even bring up that remembrance, but one of my sons would say, yeah, Mama, remember when? And it would come back to me. So going through this process and having family and great friends with me, every step has been a marvelous blessing. There are some things that that I know now that I didn't know then, and would have wished not ever to know. It has been a whole change in my life. I have, I guess the big thing to me has been the unknown in my future. I know what's going on today, but what will go on tomorrow, or next week, or next month? I thought that once I had my diagnosis, my surgery, I get out of the hospital after 5 days, and I'd be back to living my life. Well, I am, except that life is a whole lot different today than it was then. Everything that I do in my daily schedule is scheduled. I keep a document that every day I checked off the things as I complete them. Because I found out on the beginning that every day kind of seemed to be a duplicate of yesterday. And I would think, now, did I do that? Or did I just think I did that? So, for me, maybe not for others, but for me, I have to keep it on paper. Everything about my schedule. And I am, or was, a person that I never focused a lot on me. I always focused on the people around me, my family, my friends. And now I have to focus on me. I have to keep my schedule. I have to exercise my mouth at a certain time in the morning and a certain time in the evening. And I eat or drink my cans. I do that at certain times. Now, if my schedule, if I miss one of those times, of course I can make it up, and I do, but it makes it a little harder. So I have tried very hard to maintain and keep my schedule. I've had a lot of people to tell me, and you look great. You have lost so much weight, and you look so good. And my response to them, a whole lot of the time, has been, yeah, I had some weight that I needed to lose, but I didn't want to go to this extreme to lose it. So, if you want my diet plan, I will give you the name of my surgeon.
Okay, we're good.
Yeah. Still want to talk to you a little bit more about my treatment. When I had my surgery, they removed 6 teeth on the left side, and so later down the road, I had to have an implement, a denture. I think they call it arbitrator or some big long word. I call it a denture. But before I could have this denture made and have the impression, I had to be able to open my mouth to 25 millimeters. That was my target in order to be able to get an impression. Now, when I started all of this, my mouth had locked down. I couldn't get my finger between my teeth. Now, some people, they have a bigger medical name. I called it TMJ. Meant I was locked down. We tried several things. we tried using tongue depressors, and every day add another one, and do that several times a day. Wasn't getting me anywhere. Then there was another implement, I forget the name of it, but not important, that I had for a short period of time, and it really wasn't helping either. And now my oncologist, Dr. Murphy, discovered this deal. It's called Splint, all one word. Very expensive. The cost was $5,000. My insurance paid every dime, and I thank God for that. But I know in my heart that there are people that don't have insurance or a way to come up with the funds. That's another reason, in my opinion, that this Courage Unmasked, helping those who need the help, why it is so important. Now, this contraption, if you will, I still use it twice a day. Now, I was using it 4 times, trying to get my mouth open. It took me 2 years, a little more than 2 years maybe, to get my mouth open far enough for the dentist to make that impression. So, but this dude right here, it helped me to be able to accomplish that. And I am very thankful that I had it. Otherwise, I think I would be right back there. Now, it inserts in your mouth, and then it will apply pressure from top to bottom, and it the tension can be increased or decreased. This was a saving grace for me. And I'm sure I'm not the only one that has that need. But I thank God for Dr. Murphy, who cared enough about me to investigate and find this product for me to use. So I want to encourage those of you to take part in a benefit called Courage Unmasked. Now, you may think I'm courageous. Not so. I went through the treatment that my doctor recommended. I had enough respect and honor in them that I trusted their decision. And I am very thankful that I now am unmasked. And so this mask will be donated by me to an artist to make an art piece, whatever they see fit to do with it. And it will go to raise money and dollars for people with head and neck cancer that may not be able to afford certain treatments or certain things that they need. I am very thankful to be able to participate in what I feel is a very worthy cause.
Hi, my name is Shirley, and I had nasopharyngeal cancer. It was stage 4 when we found it, and that was in 2006. I was project coordinator. My degree was in organizational communication, and I worked for the Department of Energy at a nuclear plant until I was diagnosed in 2006. I worked the rest of the year while I was taking my chemotherapy, but in January of 2007 is when I started my radiation, and I can't work anymore. Probably my biggest social complication is being able to go out and eat, or eating family dinners or whatever with family. I can't swallow unless food is blended. I can't taste anything. Well, I taste different, but I can't tell what one is. And I'd say socially, we all depend on eating a lot with our friends, and that's been one of my biggest things. And then the toss and playing in general. It's embarrassing sometimes to try to visit with someone and different letters don't come out like other letters, and it's hard, but I'd say socially those two things kind of make up my differences. Probably the biggest lesson you learn in having cancer is about cancer and about how unless somebody's been there, they don't understand. It's something that once you learn a lesson that life is a day-to-day process and that it can change overnight. And then how do you deal with that? And I guess biggest lessons I would say is important is attitude and endurance and deciding to stick it out, and that you'll make the best of it. And possibly, maybe it'll help someone else. Lessons learned is that people are so important, and how they feel about you or being able to talk or whatever, that there's just one day at a time, and that's the way you kind of deal with it. I guess one of the greatest blessings is the fact that my life changed. I had been a single mama for a long time and had raised them when they was on, and so I was pretty much by myself. I had relationships that probably didn't need to have, and my biggest blessing is probably making sure my life is straightened out, and I have God as part of my life again. And I have my family, a blessing. I moved to the area where my family, most of them live, 2 hours we live here. And so I've got to play grandma and a social mama to my kids. I probably would have had I stayed away by myself. So that's been my blessing. I live well. I'm not independent anymore, which was always a good feeling, but it's also good to know that you have the family behind you and very supportive. I guess if I had to say something I wish I didn't know now that I didn't know then, would be just cancer in general, but I think maybe that's a first impression more than it's really what you think. Because when I talk or know someone who has cancer, I know the whole situation is different. I know the family is different. I know that cancer changes everything. And so I guess I can't say, so I wish I don't know now. But I guess one thing, if I try to come up with something, is figure out the way you're living now, and maybe how some of that to change greatly is better for everybody.
My name's James. I was diagnosed with cancer 5.5 years ago. It was throat cancer. When I was diagnosed with throat cancer, I was a disc jockey of all things. And so I was very traumatized by it and thought my world had ended because they told me I would lose my voice. They were taking out my vocal cords. And so at that time, I thought my life was over. So anyway, they took out the vocal cords. I went through radiation, chemotherapy, and feeding tube for a long time. Finally got in a prosthesis, and after some difficulty, learned to talk with that. But before that, I read a book by Scott Hamilton, and in it he talks about you can do one of 3 things when you get cancer. You can either succumb to it and just give up, you can adapt and just get by, or you can evolve and come from it and change your direction. And that's what I chose to do. My stage name was Rev, so I changed my name to Robo Rev, used my electrolarynx, and opened my show with Mr. Roboto. And that put people at ease about it. So I continued to DJ for 4 more years until I was forced into retirement because of heart conditions. And so now I am happily retired and spend my time just spreading the word about it, talking to pre-ops and patients that are going to have surgery, tell them there is a light at the end of the tunnel. If a DJ can do it, anybody can do it. And so now that's what I feel my calling is, and that's what I enjoy doing. I at a karaoke party for our speech group were people with laryngectomies, which, felt comfortable enough to get up and sing in front of their peers. And that's what we need to do, spread the word out there and make all of us feel more comfortable. And so that's what I'm after. I think the one thing I've learned since my procedure is that basically people are a lot better and more understanding than I thought. After my surgery, my voice was a lot different. I used to have a DJ voice. And after that, needless to say, I didn't. But I still made a lot of new friends. I still had a following that still came to my show. And they treat me like royalty. And it's just basically people are good. And it's taught me to be more compassionate than I was before, because I don't know what people are going through. And while mine is a visible defect in my voice, they may have problems I can't see. And so what I'm saying is just I want to be more understanding and more compassionate and just understand what people are going through. The biggest blessing I've gotten from this is immense. I always wanted to be a writer. And 23 years ago, we got involved in karaoke, started our own business. The most successful show in town in Houston, Texas. And we were doing very well. My first love has always been writing. And so now, as a result of this, God is saying to me, I've wanted you to write, I'll take your voice away, so now you have to write. So that's what I'm doing now, is writing songs and just writing. And nobody else may read them but me, but it helps my spirit so much. And it's opened up a world to me. And that's, I believe, the greatest benefit I've gotten. What I didn't know then, that I wish I didn't know now, is how this was going to affect me. I'm blessed that I'm still alive. So many people that get this don't survive, get different kinds of cancer. This is one kind of cancer that really affects you for the rest of your life. And research is growing, and it needs to do a lot more. I've just heard and read that radiation treatments are much better and more exact now, that they don't damage everything around it. And that's coming from research. And hopefully they're going to find a way to do it where they don't have to target your mouth. Because one of the worst things that's happened to me that I didn't realize was going to happen was I had to have all my teeth pulled eventually because the radiation affects it. So I'm trying to be optimistic. So I grew my mustache to cover my teeth. Now if I could grow the bottom of my beard to cover the rest of my mouth, I'd be okay. But it's just, that's the thing that affects you socially. It affects you the rest of your life. Sure, I'm gonna get dentures and, put a smile on the situation, but it's there, and it's something we all live with from day to day. The expenses are enormous, and it's an ongoing expense. We don't just walk away from it, we live with it the rest of our life. It's a different journey we're on. But I'm thankful that I'm on the journey, and I'm thankful for all the progress they're making it better for those to follow. And all I can say is God bless you, and don't smoke.
Hi, I'm Maria. I was diagnosed with squamous cell carcinoma of the base tongue in 2007. I underwent chemotherapy and radiation treatment, and after that, we learned that I still had my tumor, so I had surgery to remove 70% of my tongue, as well as some lymph nodes, and I had reconstructive surgery. So I am left with many side effects, including my impaired speech. I have swallowing challenges, amongst many others. I have a career with one of our top 5 financial institutions, and I was an implementation manager, a job that I really enjoyed. I worked on national projects with a team of individuals from different departments. It was very, very interesting and rewarding. Unfortunately, I wasn't able to return to that line of work after my treatment because of the many side effects that I had endured. It was very taxing on my stamina. I had a lot of self-care that I had to do in terms of taking care of my mouth issues. I found that preparing meals and eating was a longer process because I do have difficulty swallowing. I had to learn how to swallow again and learn how to make meals so that they're friendly for myself. I had to do intensive speech language therapy so that I could learn. I would never be able to make certain sounds again, but to learn strategies for talking in certain situations. I do physiotherapy to this day. It's been 7 years, but because of the surgery I've had, it did impact nerves and muscles. So to this day, I do physiotherapy as well as massage therapy, just to ensure that I don't tighten up. So there's a lot of self-care that I had to do, and when I added all that up, there just wasn't many hours left to have a full-time job, or to find an employer who would be accepting of, okay, just come in for 3 hours today, and or deal with, you know what, I just don't have it in me today. So for many reasons, I decided that I had to impose self-retirement. But I do have a sense of purpose in that I volunteer at Princess Margaret Cancer Center. That's where I received all of my treatment. So I liaise one-on-one with other head and neck cancer patients, and sometimes I'm just listening. Sometimes I'm advising them or helping them to navigate their way around the hospital. And I am trained from a social perspective, so sometimes I'm listening to what their concerns are, what their hopes are, what their disappointments are, and sharing my experience and hopefully inspiring them that you can move forward. It's difficult, but it's not the end of the world.
Since completion of your prescribed treatment, have you experienced any challenges in social situations you'd like to share?
I have, and they revolve around the same thing, which is trying to be understood. So, and participating in a social setting. So, for example, I don't know if it's because my heritage is Italian, but food is very important. So it's sort of ironic that I have swallowing challenges. But, so, I like to entertain. I like to have my friends and my family over. But although I have to have modified foods, I'm not necessarily able to eat what everyone else is having. The other difficulty is participating in the conversation, because I'm not able to have a conversation while I'm having food because of the high risk of choking and food going down the wrong path. So I'm pretty much silent during my meals. So, but I'm the type of person that has a lot to say. So it's difficult. So I find that when I am able to, if I've cleared my throat enough and I'm able to participate, everyone around the table has moved on to 2 or 3 other conversations, and I'm taking them back. So, and then they're used to it now, but it's different. It does take away from the momentum of a conversation and that spontaneity of a conversation. So, meeting a friend for lunch doesn't have the same appeal to me unless I know the person. If it's just someone casual, I either explain to them that it's not the most comfortable setting for me, or we'll just do a beverage instead. The other difficulty is trying to be understood. So whenever doesn't matter where I am, I could be at a store or on the telephone or at a restaurant trying to order. It takes several attempts to be understood. So that can be frustrating, especially when I feel that some of the things I'm saying are understandable. But I've learned to accept it and deal with it as best I can. Another challenge that I face when I'm out in the community is that because my voice is different, I find that when I do open my mouth to speak, people around me, I can feel their eyes on me, or sometimes I can see their eyes on me, and I know it's because of the way I sound. And at the same time, sometimes when I'm talking with a person that is right in front of me, I can tell they're trying to figure out, is this person deaf? Or is this person slow, challenged mentally in some way? So it is hurtful. I have gotten used to it, and I know that people are just curious because they want to understand. And sometimes it's so that they know how best to help you. So I know that it's not necessarily coming from a malicious place, but it can be difficult. And it's difficult to not be able to be as articulate as we once were. So these are challenges for someone who likes to talk and be heard and be understood. I've definitely learned to be more patient. That certainly wasn't one of my virtues before, but this cancer journey and the survivorship part of the journey, I've learned that I do have to be patient, not just with others, but with myself. There are things that I can no longer do the same, and that's been a process of accepting. For example, before I was able to do so much more in a day, the multitasker, but now I find I have to focus on maybe 1 or 2 things, or else nothing is accomplished. Another lesson that I've learned is to be less judgmental. I was quick to make assumptions about people, but now I know that everyone has a story, and that person in front of you who maybe is moving too slowly, there's a reason for it. So that patience has taught me also to be less judgmental, make less assumptions, and just be more understanding. And then because everyone has something that they're going through, everyone has that story to tell. So I guess those are good things, that those are good qualities to have, be less judgmental and be more patient as part of the human race. Those are excellent things to aspire to. Well, I just first want to start off by saying that I'm so thankful for the wonderful professional care that I received at the Princess Margaret Cancer Center. I cannot say enough about the institution. I cannot say enough about the doctors and nurses and all my healthcare team. But I guess I wouldn't have thought of these things as benefits before, but now I do. So, for example, as a result of my cancer journey and deciding not to return to work, I've embraced volunteering. So volunteering at the Princess Margaret Cancer Center has given me a new purpose in life, and one that I feel very passionate about, one where I'm able to take my experience and help others just like me. So either it is one-on-one with other head and neck cancer patients, and we share experiences, we share tips, we laugh at each other, because some of the stuff we do is funny, or some of our challenges can be hilarious if you look at it from a certain perspective. But yeah, we're able to laugh. You know, sometimes we try. It's hard, I'm not gonna lie. This is not an easy road. And the side effects are many, and the side effects are challenging, and for many of us, they last forever. But despite all that, I do have a new lease on life. I find that I strive for a simpler life, so not caring so much about things that I used to care about that really, at the end of the day, are not important. And if I can give you one example, my husband and I decided that we downsized from a large home to a 2-bedroom condominium. It was the best thing we ever did. It allowed us to live that simple life. We travel, so we don't have to worry about a large house. And health-wise, it's a lot easier for me to manage. So discovering that simplicity has been a benefit. Because I'm retired, I've been able to pursue other interests. So, for example, I spend time with 2 of my very young nieces who are 2 and 3. I babysit them once a week, so that is something I really enjoy. I have time for my mom, who has early stage Alzheimer's, so I have the time to spend with her and help her out in any way I can. So although these are some things are more difficult than others, it's because of the time that I have now that I'm able to pursue other passions and other interests, or make time for those around me who need me.
Yeah.
I guess I was not prepared for the level of disability that this illness would cause. And although my health team told me about side effects, sometimes it's not until you live it that you really understand it. So I thought that once you have cancer, you have all the treatment, and life goes back to normal. Well, for my type of cancer, it certainly didn't, and I know that for others with head and neck cancer, that's not the case. So I wasn't able to return to work, so that certainly caused a financial strain. I now live on a modest disability pension. But there's financial constraints on top of that. I continue to do physiotherapy and massage therapy, not as a luxury, but because it's necessary, or else I'm stiff all over, and that's an expense. I have my mouth care that I have to do, and there are certain tools that I need to purchase, and they're expensive. It's not just a toothbrush, so there are expenses. There are things that I need to help me manage. I wasn't ready for the changes in my ability to concentrate, and that comes from the chemotherapy I received. So it's just not being prepared for that, and that creates a difference in the lifestyle, the standard of living. and also this affects the sense of self, the sense of purpose, the self-esteem. I do consider myself to be a very strong person. I have a very strong identity, so I know that has helped me. But everyone is different, and I won't lie to you. This has emotional and mental repercussions. So that is something that I struggle with. Depression is something I struggle with. So I guess what I didn't realize is just how much of an impact the aftermath of cancer treatment would have. It's not over. I don't have the disease anymore, but I'm thankful for it. But what I had to live with, I did not anticipate. And I mean, I'm managing as best I can, but it's rough and it's tough. And I don't wish it upon anyone.